This is a wonderful opportunity for me, and I feel very, very proud and very, very happy to have with us today Dr. Ralph Moss. I think everybody here has probably seen what we put up on the end, and I think everybody's here because they have had some interest in alternative medicine. We now have, I consider, the world expert on cancer treatment. He's not pro anything unless it works, and he's not anti anything unless it doesn't work. He reports the good things that are happening with cancer treatment, and he criticizes the bits that don't work. So don't expect him to say that what we do is necessarily good, and don't expect him to knock chemotherapy, because he won't. He will report it. This is what is so useful. He's written a lot of books, and he is going to talk about the latest book he has written, which is very important. He is critical of the cancer establishment in America, which is only fair, and he's going to talk to you about, particularly I think, customized cancer treatment here, and he will be willing to take questions if you like to make them. We don't really want to discuss your particular cancer, but if you've got a question in regard to cancer treatment, he'll be very pleased to answer it. Dr. Ralph Moss.
Thank you, sir. Thank you. Well, I didn't prepare any remarks, and so if I ramble a bit, you'll understand, hopefully. I've actually literally lost count of the number of times I've been to this clinic. I do remember that the first visit was in late 1979 or early 1980, because it coincided with my first book, which is now called The Cancer Industry. It was then called Cancer Syndrome, and that came out in the spring of 1980. And so I came down here, and at that time, of course, it was extremely controversial. You know, this was the hub of the big battle, really one of the big battles between the National Cancer Institute and the sprawling alternative cancer movement. Larry Burton, whose portrait you see here, was a guy who was not afraid of a fight, and he took on powers that were 1,000 times more, more powerful than he, and I would say that he fought them to a draw at least. It was a bit of a David and Goliath situation. So I came down here quite, to augment my knowledge of what an alternative clinic was like. And it was only the second clinic that I had ever visited, and I wrote in my book, especially coming from Sloan Kettering, where I had worked previously, that coming down here was like a party. It was like a non-stop party every day. People in this room, or maybe it was in this room. It was arranged a little bit differently, but you would never have guessed that you were in a cancer clinic. At Sloan Kettering, I would pass through the outpatient department every day, and it was a horrible scene. People were retching their guts out, vomiting from the chemo. They had discovered chemotherapy, but they hadn't discovered how to control the side effects of chemotherapy, which are today controlled a lot better. So that was a terrible, ghastly scene. And when you came to an alternative clinic, and especially this one, you found an entirely different milieu. This was true in Mexico too. At the first clinic I visited, which was the Contreras Clinic, now Oasis of Hope, a very calm, placid atmosphere. The doctor played the guitar and held, religious services for his patients and this sort of thing. Burton was a bit more of a unseen presence, I would say, in the clinic. He wasn't so hands-on. He would sort of stay in his office and people would come to visit him. But the joke with him was that, he smoked, perpetually smoking a pipe, and whenever a patient had a remission of their cancer, they would give him a gift pipe. That's what he wanted in return. And of course he had this enormous collection of pipes that testified to, it was like in Lourdes they hang up the crutches. Well, you could see how many people had been put in remission by the number of pipes that he had, and he smoked continuously. So I couldn't really come to any conclusion about the effectiveness of the treatment, but I certainly came to a very quick conclusion about the psychological effect the treatment had on people, and the fact that they felt better, they looked better, they acted better. I mean, whether, some of this was due to the weather, and some of it was due to the fellow feeling among the patients, which was tremendous, and always has been a strong point of the alternative clinics around the world, most of them. So I had a generally positive impression, and then over the years I came back under different circumstances, both when Larry was alive and then after he passed away. And I met Dr. Clement on that first visit, so I've known him for 31 years, and he's one of my oldest colleagues and friends in this whole field. And I've watched the clinic, its ups and downs, and its efforts, its struggles, and so forth. And I must say that I'm very encouraged by what I see on this visit. I think Dr. Kevin Bethel is amazing, and I feel confident, I'm sure you all do, that the clinic is now engaged on a new path that's going to be even better. New things are going to happen here. Part of what I like in the direction is that I feel that the strong point of complementary and alternative medicine, or CAM, has always been its ability to focus on the individual. That when you go to a standard cancer hospital or cancer clinic, overwhelmingly the emphasis there is on coming up with protocols, different treatment plans that are applied not based upon who you are as a person, but based upon the name of your disease. So you have a certain category, and the category is based on where the tumor first popped up. And then you have you're given a certain stage within that category. So you're now a stage 3 ovarian patient. Well, the thrust of industrial medicine, if you want to call it that, is let's make a chart or a little handbook, and you can look up stage 3 ovarian. Aha, we give carboplatin and Taxotere, and here's the amount that we give for so many and so many weeks, and then you send the patient home. And this is very convenient from an industrial point of view. I mean, Henry Ford would have appreciated that kind of medicine, or that development in medicine, right? Basically it's the assembly line approach. What's wrong with that? Well, aside from the fact that you feel like a cipher when you're given a number and treated like just based on your definition, cancer is not quite so convenient in terms of its willingness to cooperate with these treatment plans. The treatments oftentimes don't work all that well to begin with, and secondly, everybody's different. I mean, this is just a fundamental fact that you can make plans and programs for people, but not everybody is the same. 9.5 is the average shoe size for men in the United States. I happen to wear a 10 shoe, so I probably could squeeze into a 9.5 and just sort of hobble around all day. But if you happen to fall into a smaller size shoe or a larger size shoe, you're going to be seriously uncomfortable. But if you took the law of averages, everybody should wear a 9.5 shoe. It would work for those who happen to be 9.5 size shoe, and it would work poorly for many others and terribly for many others. And cancer is no different. The tumor itself varies, based on a lot of factors that we could discuss, and each person is different. So chemo, which is tolerable for some people, is disastrous for other people. And I see this all the time. I do phone consultations for cancer patients, and all the time I see people who get the same regimen, because it's the same regimen that's recommended for basically for everybody. Some of them skate through it with no problem, and others have fatal effects. People die from chemotherapy or from the after effects of the chemotherapy. Not commonly, but it happens. Why? Why did that one person get through and almost not even know they had anything happen to them, and then other people have, wind up hospitalized or even dead? Clearly, there's stuff going on below the surface within that individual, stuff that may not even be recognizable through the usual tests that are done, and yet have a very big effect on how the individual responds. So we have the problem of the ineffectiveness of a lot of the medications and a lot of the treatments that are done in cancer, in oncology, and then we have the other problem that everybody's different, so people are going to react differently. If the medical system isn't honed in to the concept of individualizing treatment, they're unlikely to be able to help you if you get into trouble with the kind of treatment that they're giving. So very often, the doctor, who's almost always is sincere, honest, maybe very nice, maybe very knowledgeable in their own area of chemo or radiation, no question. There are, brilliant minds out there, but they're not thinking in those areas, thinking clearly in those areas that are going to most affect the outcome of the treatment. And this is a very big problem throughout all of medicine. And there's no one solution to this. I don't want to, make like I have a panacea for this. It's nothing like that. But I think you can see down here that even in his own way in the 1970s, Burton was already thinking somewhat along these lines. The biggest thing was that the treatment is reestablished every day. I mean, what's given is based upon a daily test. Whereas with chemotherapy, you get your protocol, and that protocol is carried through for the entire course of the treatment. There's no variation on it, because very often it's based upon results of a clinical trial that had nothing to do with you as an individual. So I think, in that sense, Burton was way ahead of his time, because he was individualizing the treatment based upon the results of a daily test. Now imagine if we did that with chemo. I mean, it would be a different story, but that's not generally done. It's never done, as far as I know. The other important point about the individualization was that Burton gave free rein to the autonomy of the patients, to them as individuals. He respected them in a way that really nobody else, I think, up until that point had done. He wasn't trying to control them, even in a medical sense. He was trying to be a teacher and a guide rather than a controlling force. And that's why there was a party atmosphere in the clinic, because everybody who came here, none of them felt compelled to be here. They had all come of their own volition. They remained and retained their autonomy. There was no hospital atmosphere to tell you what time you had to get up, what time you go to sleep, whether the lights should be on or not be on, whether it was not a compulsion on the person, so everybody felt like they were on vacation.